When we discuss pathology of the knee, one of the common ones is known as the popliteal cyst. It's actually not the knee, but it's the popliteal area. The popliteal cyst, or the Baker cyst, almost like a ganglion cyst on the wrist. This is going to be usually a painless, non-pulsatile swelling in the popliteal area. Typically you don't need to do anything about it. Part of your differential diagnosis may be a lipoma, rarely a tumor. Typically it's just this little area of bursa. Then no treatment is necessary. It tends to resolve. A patient with Osgood-Schlatter's, when you're reading the history, look for someone who is doing repetitive exercise or trauma to that leg. So for example, like a drill. This is a patient that's doing basketball or playing volleyball or gymnastics or softball. And so they drill and they practice, and it causes a traction apophysitis. Even though it's considered a problem of the knee, it's actually a problem of the tibial tubercle. The muscles insert at the tibial tubercle, and when you overuse it, in this growing bone, it keeps pulling and pulling and pulling, and you get an area of swelling and pain on palpation right at the tibial tubercle. This is a pretty classic presentation. You really don't need to be too suspicious for bone tumors. The patient just has that point tenderness right there. The best thing to do is to just give them rest. This is very hard because they're so active playing different sports and doing different things, but they need to rest, and eventually it tends to subside.